Okay. What's up, Pack?
What's good?
How you doing, bro? I know we
Good.
already got into the conversation, but
Yeah.
if you could just say a little bit about yourself and then go just talk about what you're going through right now with your first year of PT school.
Yes, sir. So my name is Elijah. I'm a first year PT student at UNLV. I know Ryan through high school basketball. We're teammates. Haven't talked in like what 5 years, something like that. It's been a
Crazy.
minute. But Ryan over here got into PT school and going to Chapman, so really happy and stoked about that. Um, yeah, we're just talking about like school and everything, and it's a grind. You're definitely sacrificing, all your time, all your energy, just on, just studying. And basically what I was telling him was I mean, we're talking about probation. We're talking about how hard anatomy is, how hard neuroanatomy is. And so, these programs they don't want to kick you out. They want you to graduate, they want you to they're taking your money basically. It is a business at the end of the day. And so different programs are, they have different policies. But our school, there's something called academic probation. If you don't, I guess, pass a class, and passing for us is like a B. So if you get like a borderline C plus, you're sent into probation. But you're kicked out the program if you get another C or if you get two consecutive C's within a semester. So for us, like grades are super important. The professors are there to, help you and give you all the resources.
Right. That's crazy.
Yeah.
So, what would you say is the most rigorous um class like you've had to take so far?
For me, right now, it's MSK, so musculoskeletal and neurophysiology. Just cause like honestly, it's just the workload, the amount of information that you're learning, and just how important these classes are. So I think the analogy that my mentor gave me was think of like drinking out of a fire hydrant. It's just like a whole bunch of information is being thrown at you, and you can only take or retain so much. But that's just how hard it is.
Hmm.
So it's honestly it's just a grind. Yeah,
Right.
it's
Right.
brutal.
Something my training mentor taught me too. He was like, I was complaining about, I think I was taking physiology undergrad, and I was like, man, I don't even need to know any of this stuff. Like, it's never going to apply.
Hmm.
And he was like, well, you have to know, uh, you have to develop your box before you can start to break the rules and think outside of the box. And he's like, the bigger your box is, the better you off you are. So,
Yeah.
yeah, and even though it's a grind, learning all the little things you're probably never really going to go back into, you know it's there. And
Yep.
if some new therapy comes out where you just know, like you just have a better understanding of the body. So,
Exactly.
I don't know. Um, cool. So what got you into PT? Like, why did you choose this career path?
Yeah. Yeah, we didn't really talk about it, but I don't know if you remember, but I actually tore my meniscus my senior year, and that's when the season ended.
Right.
Um, so I actually didn't find out until my first year of school of undergrad.
Oh my
Because
God,
I
that's
just yeah,
gnarly.
I was like hooping, and then I'm just like, oh, like my knee hurts, but then I was just like, I thought it was just patellar tendonitis. But then yeah, come to find out it was more serious than that. And I was like, dang. So I took a year off, just like rehabbing, no surgery was needed. And then at the time, like my parents were kind of like, oh, try this, obviously, with Asian parents, it's like, oh, try to become a doctor. So at first for me, it was PMNR. It's like a pain management and rehab doctor.
Hmm.
But then didn't want to take the MCAT. And
Don't
so,
blame you.
yeah, like I'm not studying for that.
Yeah.
And so PT was like just like this new um passion that I had, I guess. And so it really started at UCLA Medical. So when I was a senior in high school, I shadowed there. And so that kind of exposed me to like PT firsthand. And it was just like, it was just really cool, just like the vulnerability of it, the relationships you make. And then at the end of the day, like for me, I want to work in sports, get back into that team environment. That's one thing where I was like, I would have loved to play college hoops, but at the end of the day, like, you know, that's like another step, the training,
Right.
just the grind. And, for me, it was like, I'll change my passion into rehab, athletic performance. And so that's just kind of how it all started.
Right. Yeah,
Yeah.
because people don't understand. We played on a team with several G1 players, an NBA player.
Yep.
Like it is a grind.
Yep.
Like,
And
and if
yeah,
your body can't handle it, body can't handle it. But um I think it's interesting, like us coming from the Hooper realm, getting hurt, and then we want to go back into it with all this new knowledge is like
yeah,
we know exactly what these people are dealing with. And you hear about load management for rookies and second years all the time. And it's like we've been playing 7 days a week since we were tiny. And
exactly.
it's like no wonder we have all these injuries. So
Yep.
um yeah, I'm excited to see what the future holds for you for sure. Um cool. So that's great. So, um, I might edit some of this
Ah,
out.
you're good. Honestly, I want to hear why did what made you want to go into, PT and pursue PT school? Because, this is a whole other like commitment. Like you're sacrificing, 3 years of your life just,
Right.
studying, grinding, and I just
Hmm.
want to hear about, what made you want to pursue this.
Right. 100%. So similar to you, um, you know my story. I had so many
Yep.
injuries, three
Yep.
foot fractures, ended my playing career. But through that, I met like my training mentor, and he just taught me so much about the body. He helped me rehab. And I just like it totally shifted my lens of how to train and appreciation for the body. Um, and I that's when I got into personal training. Like I started working with people. But I think what got me on the PT realm is just the opportunities. Like once you have the DPT, there's just so much flexibility and
Mhm.
stability
Yep.
that I think was very attractive to me because I mean, I've trained for a couple years now. It's business is unpredictable. Like
Mhm.
there's definitely ebbs and flows and working with clients and not able to take insurance. I think that's a huge advantage. Just being exposed to a lot more clientele. But also just the opportunity to learn
Oh,
from
yeah.
a lot of smart people and just, I don't know, learn about all the different avenues you can explore because there's so
Yeah.
many. And maybe that's something, could you explain to people like what a PT is? Because when you hear physical therapist, you might think someone you go see after you like you tear an ACL
Yep.
or something like that or rehab an injury, but I think there's a lot more to it that most people don't realize. Could
Oh, yeah.
you explain a little bit more about that?
Yeah. So there's something going on like with different bills and policies where they're, making PTs or they're allowing PTs to be that like first point of contact. So like, you go see your primary care physician and you do the whole like, physical for, work and like school. And honestly, like a lot of PTs are able to do that right now. In Utah and like I think in Vegas as well, like we're able to order MRIs and X-rays. And that changes the game a lot because now they don't have to like go through these like different providers to see the PT. They
Right,
could see the PT firsthand and then we could be like, hey, like, we think it's this because we're professionals in, being able to diagnose like, different pathologies regarding like human movement and like as you said like ACL tears, being physically active, all that stuff. But now it's like, we're like, hey, we think you have this, let's send you to get an MRI or an X-ray, and then you could come back to us instead of like, going through all these loops. And I think you hit a good point with just like the opportunity stuff of things. As a PT, you're able to work in so many different settings. We have like, you could work with the geriatric population. You could work with like super active people, with pediatrics, with pelvic floor. And so like, that's one thing that also kind of like, you know, I saw PT or like I fell in love with PT just because of like, the opportunities out there. And like not being very close-minded. We had a lot of
Mhm.
speakers this past year where they're just like, a lot of them are business owners, and a lot of them are saying like, you don't specifically have to work with this population. As a PT, you're able to, work in this population and work per diem in another, setting. And so for us, it's like, the opportunities are just, they're wide, and they just don't want us to be, enclosed in this one setting and be closed-minded. So
Right.
they're like, pushing for a lot of that. And as PTs, like, we're in demand. Like, in these next coming years, like, in Nevada specifically, like, there's a PT shortage and we get paid the most in the state. And so, our demand is, increasing. And so, it's just the opportunity. It's great.
Right. Wait, so you're saying you get paid the most out of all the states or in the
Yep.
state?
Out
Really?
of all the states. Yep.
I know.
California and Nevada are pretty hand in hand.
Okay, yeah.
But then, with living expenses in California, it's like,
Right.
yeah.
It's damn taxes.
I don't know, man. Especially with businesses, like, dude, the amount of like business taxes in California, it's like it's impossible to open up a business. But here in Nevada, it's like there's none. And so you could literally
Right.
just create your own business and then go start treating somebody.
Right. That's interesting.
Yeah.
Yeah, that's crazy.
Yeah.
Yeah. Um, so what are you considering doing? Are you just gonna fully go the athletic PT route, or are you gonna kind of blend it, or are you just waiting to decide you're not fully set?
At first it was like, oh, I'm gonna go, with a sports team, be with them for a little bit. And then after that, like maybe hopefully open up business. But as I'm going through school right now, like, and listening to all these like different, avenues of PT from, different, professionals in the field, like now I'm just kind of like, I don't know what I want to do. So I'm open to options, but at the end of the day, like I do want to work in sports with athletes. Um, but kind of like having that blend as well, like just having patients, that I have on the side, with like home
Right.
health, and then but also have that stability with working at a clinic or at a hospital or honestly whatever it may be. For me, like coming out of graduation, the biggest thing is mentorship. The first 3 years you come out as a new grad, that's like a super like delicate and vulnerable moment for PTs just because that's when burnout is the highest, and that's when like that kind of shapes what kind of clinician you're going to be, for like the rest of your career, basically. So for me, it's like mentorship is super important. Luckily, I do have one in Vegas, and hopefully, like, I will work with her when I graduate. And yeah, that's honestly the plan.
Why is it the first 3 years? Why are those so crucial?
Um, I don't know. I don't, it's just something a mentor told me, but again, it's just like as a new grad, it's I don't know. When I think about it, it's just the most like vulnerable years, I think. Just because,
Building
PT,
clients and like
yeah, building
your
clients,
yeah.
just honing in on like how you're gonna, do your evaluations, your skill set. Like in PT school, you're given all the tools. But then it's really like learning how to apply those tools. And you don't really learn that until, the first couple of years when you're, graduated. And so I will advise you this, like learn as much as you can, set your foundation in PT school, but don't let it be a deal breaker just because for me, what I'm experiencing right now is, there's so much information and I'm trying to learn it all, but then I'm stressed by the fact that like because I can't learn all of this and remember all of this, I can't treat my patients well in the future. So
Mm.
don't be
Hmm.
like stressed about that because you'll learn it in the clinic and you'll learn like shortcuts and just like, you know, it's just when you have 20 years of experience as a clinician and
Right.
you get that like Spark Notes version of it,
Hmm.
it's super valuable.
Right.
Yeah.
Yeah. Yeah. That's facts. But have you done personal training? Have you worked with people outside of PT?
Um, no, but I was a strength and conditioning intern for like 2 years at
Okay.
Minnesota. And
Hmm.
so I kind of got my experience just working with athletes then.
Right.
But outside the clinical setting,
Wait, Minnesota? Is that Cal Dietz?
yeah.
You worked with Cal Dietz, bro?
I've worked with him once. I've interacted with him like 3 times because I did like some research with him. But
He's a
yeah, he's the
dude.
GOAT.
He's a
He's big
god.
time.
Yeah,
Yeah,
he's big
he's
time.
yeah, there's a lot. I mean, did you read Triphasic?
I haven't like bought any of his stuff, but I've done
Yeah.
RPR. It
Yeah, yeah.
reflects all
Yep.
the RPRs. Bro, I
Yeah,
was
yeah.
doing those in Notre Dame. That's how I got through.
Yeah, no. I kind of thought back and I was like, hold on, I saw this before. And I just remember
Yeah,
you doing all this and I was like,
do,
ah, yeah, I remember
doing the
now.
RPRs,
Yeah,
bro.
yeah, yeah,
Yeah.
yeah.
Wow, that's insane, Pack. So
Oh yeah.
you came up with like some really good mentorship.
Oh yeah. Like I've been honestly super blessed with, the mentors I've,
Wow.
had. And so, and I try not to limit myself with just PT because I think the best PT is those who could collaborate with other, other fields.
100%.
So, I met like basketball trainers, strength and conditioning coaches, researchers, but then, just trying to be more proactive with like medical doctors and like,
Right.
those kind of people. So,
Yeah. Yeah. Yeah, that's awesome. I wish there was more, like, especially when I was going through PT, I wish there was more
mm,
continuity, like, between all
yep.
of them. Because it feels like right now, everyone's just in their own lane. But
Mm,
I feel like coming together and creating relationships is just better for patients, for
yeah.
sure.
No, that's why I like sports so much because, with a sports team, you have like, all these different, you have nutrition, you have AT, PT, strength and conditioning, sports scientists, like all of them just working together versus, you being in the clinic, just you and the patient, and that's it.
Hmm.
Yeah.
Yeah, definitely more perspectives for sure.
Nope.
Um, so how long did it take you to heal your knee, your meniscus?
It took me, I'd say about like 8 months.
Okay.
Yeah. I think a lot of it was strengthen glutes, just a regular like, loading it, progressively loading it, um,
Hmm.
and then eventually like return to sport kind of stuff.
Right.
Uh, yeah, so it wasn't like honestly, I'd say I tore my meniscus, but like thinking back, I don't think it was that serious,
Right.
you know, because all of us like for me or if you take an X-ray of everybody, everyone's gonna have like, some kind of messed up thing in their knee or in their shoulder.
Right.
But
Right.
if it doesn't cause you pain, like, what's the whole point? Like
Yeah.
it doesn't mean anything. And
Yeah.
yeah.
Though, bro, it's so interesting learning about pain. Do you guys learn about pain?
Oh yeah.
Yeah.
We had a huge lecture. His name is Dr. Lowe, but he's a big like pain neuroscience education guy. And the thing, yeah, it's really crazy. Just like, the body's reaction to pain and just like yeah, it's a lot. It's so much, but
Yeah.
it's super interesting.
And like you were talking about with like if we scanned everyone, there's people with messed up shoulders, but they
Oh
might
yeah.
not have pain. But
Mhm.
there's people who are perfectly fine and they do have pain.
Yep.
Like
Yeah.
it's interesting.
Yeah.
Yeah. Crazy. So, what is something you wish you knew before you started school?
Mm.
This one's for me.
Yeah, I know. I got you. Dude, honestly, for me, like at least when I was going into school and starting that first semester, like I knew what I was getting myself into. Um, So I failed anatomy in undergrad. And that was honestly like my biggest fear is just like failing anatomy because I knew what I was getting myself into. And I was just like remembering back to like, because I took anatomy in during COVID and we were actually like in person during then. And we had like in-person lab with like cadavers and everything. And I was just remembering back and it's just like it was just PTSD. Like yeah, I just really did not want to do anatomy. So that first semester, I was like, okay, I'm gonna be locked in. But just find like a study strategy that's like good for you. Something that works for you and use that first semester to like try new things and try to just figure it out. So what I did was I used Quizlets. I think that was a huge um, resource. Just trying to like remember all the origin insertions, nerves, and actions and all that. I've used group study sessions. Preferably, I like to use like smaller groups, and then just like kind of go around and try to teach each other concepts that I don't really get.
Mhm.
Um, and a lot of it is just repetition. At the end of the day, like you already know, like you gotta get your reps in.
Right. It's like
Same
getting
thing with
shots up.
literally.
Yeah.
Except getting shots up, it's easier than studying. I hate.
Yeah.
Oh my goodness, I
Yeah.
hate it. But yeah, I mean, just try out different study methods, and just be ready to grind. That's all I can tell you, honestly.
Yeah.
No.
Okay. Yeah. Now, I remember anatomy. I did it during COVID. But we were in person, but we had masks, but we did it with plastic models.
Mhm.
But the cadavers don't have different colors for the veins
Nope.
and the arteries.
Nope.
So it's a little bit harder.
Yeah. And are you guys doing dissections or is it like already dissected for you?
I'm not sure. I'm
Okay.
not sure yet, but I would assume I'm pretty sure we're using cadavers. I'm pretty sure
Okay.
that's what they said on the tour. Yeah.
Yeah. It's
Um,
yeah, cadavers are different. Each body is different. For us, we had to dissect. And so like just going through the skin, the fascia, the fat, taking all that out, and then going through like, different muscle layers and nerves and arteries and veins. It was like, yeah, it was a lot.
yeah,
But then I feel like that definitely helped, my learning and just knowing like where everything's at. Um,
100%.
yeah. And
Just
so, mhm.
more vivid when you're smelling it and
Dude, oh,
going
it's
through. I can't. I haven't seen a cadaver yet.
yeah. It's
Yeah.
not it's not too bad. The bigger thing is like the smell of it. But
Oh.
yeah, but bro, like some of our classmates, they be staying there for like 4 hours straight. And I'm just like, bro, I'm in there
So
studying
that's
and
a little
looking at the
sus.
body. Yeah, it was bad. Like yeah, I don't know how they did it, but they did it.
Yeah. Got to get some fresh air for sure.
Definitely.
That's awesome. So, are you on like a training regimen? Like, how do you work out as a PT student?
Not gonna lie, I don't.
You don't work
I
out.
Bro, I've neglected my own physical health because of like studying, but honestly, that's just an excuse. Yeah, for me, it's like like practice what you preach, That's one thing that I tell myself, but obviously, different stresses, different, circumstances, my
Right.
priorities are different. But then, yeah, I mean, the last time I worked out, I mean, shoot, we did a Pilates lab today, so I don't know if that counts. I mean,
That
some,
counts.
but last time I like actually lifted weights or like went on a run, probably last week. Yeah.
Oh, I thought you were gonna say like last
Oh no, no,
year.
no, no, no.
Yeah.
Hell no.
Yeah, dude.
Oh,
Dude,
bro, what?
Pac, you have to understand, there's people who don't work out ever.
I know, but you gotta understand that, like guys like us who like, did practices every day and like
Every
hooped
day.
every day
Multiple
and
times a day.
multiple times a day, and you like go from that to like working out maybe once a week. That's just like I don't know. Like I crave it. Like obviously I'm here like sitting and studying and like, there are days
Yeah.
where I'm just like, damn, I wish I could just, go get some shots up or like, go lift and stuff. But, part of me is like, oh, if I do that, I'm not going to score well on my exam because I,
Mm,
sacrifice this to study, but don't think that way. That's a bad
damn.
way of thinking because, yeah, I mean, as you know, there's a lot of studies linking, physical activity with like, memory consolidation, just like, remembering a
Right.
lot of things, and like studying as well. For us, we're learning this in neurophysiology right now, but, have you heard of BDNF?
Uh, neurotrope.
Yeah,
It's
yeah,
a brain
yeah,
thing.
yeah,
Yeah.
yeah.
I think I
But
heard of it.
basically, yeah, yeah, no. So basically, if you get like 30 minutes of like aerobic exercise, your BDNF skyrockets, and after that you study and you just basically remember everything you studied. That's
Ah,
kind of what it is in
yeah.
a nutshell. But yeah, super important. So I've been trying to run more. I'm running a 5K tomorrow. So
Hey, see, you're
yeah,
working out.
yeah, not as much as I would like to, but
Yeah.
trying to.
I've actually started getting into running too, and I just like the
Yeah,
idea of like endurance, like
yeah,
mental endurance, because usually, like hoopers usually are just like explosive athletes and
mhm,
it's like quick.
yeah,
But I don't know, I've kind of transitioning into like someone who wants more endurance, like mental
yeah.
endurance, physical endurance.
That's
I don't
good.
know. Yeah, because if
I'm,
shit goes down, I want to be able to run for a long time.
yeah, I mean, yeah. I mean, a lot of our goals are like, running half marathons and like, running marathons eventually, but I probably won't get to that point. Maybe I'll run a half marathon, but for me, it's like, we'll see. I'll try to hoop as
Yeah.
long as I can.
Yeah.
Uh,
Seriously, once a hooper, always a hooper. Never lose
I know.
that.
For
Seriously.
real.
Every time I go back and play, even though it's like once a week, I'm just like I just feel so much better
Oh
after.
yeah.
Yeah.
You just go to
Um
like open runs and stuff.
well, I train some basketball players, so I usually just like guard them or have them guard me.
Oh
So
oh,
yeah,
yeah.
that's usually how I hoop.
Yeah. I mean, so, Impact is out here too. So
Yeah,
I be going in pretty often and I see Joe all the time.
that's
Um,
awesome.
but yeah, that's what, like this past summer, just like garden passing, setting screens, pop, all that stuff. Just like, getting my reps in kind of like, through that. Yeah.
Yeah, 100%. It's good cardio for sure.
Oh yeah, definitely.
Releasing the BDNF.
Yes, sir.
Okay, cool. So, how do you study? I know you said you study a lot and it's a grind,
Mhm.
but like, what's your thought process behind studying?
Yeah. So I really emphasize like the key like outlines that your professor set in like the first like two slides of your lectures. Um and honestly it's broken down into like three categories. It's your knowledge-based questions, your analysis questions, and your clinical-based questions. So those are like how professors are going to test you for your exams. And starting with anatomy, like it's going to be like that. What you know, how can you apply it in the clinic, and then can you combine like this concept with this concept. So with your knowledge-based questions, I'm still like struggling with it, but still trying to like try different methods. And I made it this far, so it's just kind of like doing what works, doing what, getting rid of what doesn't. But I use a lot of Quizlets. Notability has this what is it? It's like post-it notes where you could like cover up, certain things and then memorize like that. Um, ChatGPT, just like them creating you practice questions, that's super helpful. And then honestly, like group study for me. I like to just grab a couple of friends and then try to explain these big concepts with each other. I find that super, super helpful. And rewatching lectures. Hopefully they record your lectures. Usually they do. But then just going back and spending the time to like rewatch it, understand it. Because at first, like I thought, oh, it's a waste of time to rewatch lectures because that's like what 2 hours just watching it over again. But found that super super helpful because you know you go through it the first time and sometimes you're not always locked in, but then you go through a second time with a fresh mind and you start to like remember stuff and start to make these connections. So
Hmm.
that's just kind of some of the things that I do.
Nice. And what would you say the duration of your studies are like, and how frequent throughout the day?
Yeah. So usually we have class from like 8 to 3-ish, 8 to 4-ish, and then take a little break after that. And then from like 5 to 9, just kind of studying. Um,
Really?
yeah, whether like, you get a workout in within for an hour. But then for me, I usually stop my studying around, I mean, obviously depending on like exams and stuff, but usually stop it around like 10 or 11. So yeah, that's just, going over the material from the day of, because that helps a lot. And then or like preparing for the next day, whether it's like a video I have to watch or any assignments I have to do. Um, it kind of varies, but yeah, just try to be super organized, have a schedule. I think that's the best that you could do for yourself.
Yeah. I'm learning that I need to get good at Google Calendar.
Oh yeah. I mean, shoot, even I don't my Google Calendar sucks, but I use notes, and then in on Sunday I just kind of create this like Monday through like Saturday schedule.
Hmm.
And I'm just kind of like, okay, I have class from here to here. And then I'm gonna study this for like 30 minutes, study this for 30 minutes, and then kind of switch it off.
Right.
Um, so just kind of like mapping out what you're gonna do throughout the week. Um,
Hmm.
yeah, definitely useful.
Yeah. I'm trying to practice now so that I'm
That's
prepared.
good.
Cool. Do you think basketball prepared you for this? Like this workload?
Um, it's different.
You can't equate them.
You can't.
Yeah.
Yeah. I mean, yeah, with basketball, with all the practices, the lifts, the games and, the travel and all that, like, a lot of your time is spent doing that.
Hmm.
But for me, I just can't like compare something that I enjoyed to like studying, which is something that I really don't like. I mean,
Yeah.
like I have to do, and like I find joy in like studying, certain concepts just because it's super interesting. But
Hmm.
for me, like I really don't like studying. Like I just want to get out there. Like for me, I'm a very hands-on guy, like doing, internships and like, gaining experience, learning under a PT or, somebody, anybody. So,
Yeah.
being in the classroom for me, it's a struggle.
Hmm.
Um, but you know, I mean, yeah, I mean, I guess it was helpful with like, managing your schedule and all that and being, responsible and all that stuff.
Right.
But um, yeah, studying is a different beast, in my
I,
opinion.
I'm the same way, bro. I gotta move. Like I have, if I'm not working out at least once a day,
Yeah.
I literally will go insane.
I know.
Yeah.
And honestly, for you, it's like, what are your priorities? And so, for you, it might be working out. So,
Yeah.
finding the time to work out before, school starts, it's always a good one.
Yeah.
Or, going between classes. That's what me and my classmates sometimes do. Or
Hmm.
going like right when you finish classes, going to work out. So you'll find like little pockets here and there. It's just a matter of like keeping that consistency
The
and
rhythm. Yeah.
yeah, and like what your priorities are.
Hmm. Yeah.
Yeah.
100%. Cool. So you spent a lot of time like in clinics around strength coaches. What do you think makes a great, not, I don't want to just uh uh bucket physical therapists, but like coaches, strength and conditioning coaches. What do you think makes a great practitioner? I think is a term that can kind of encompass all of
Mhm.
those different fields.
Yeah. I think for me, it's how personable can they be? Like you learn all this information, but if your patient or if your athlete doesn't buy into that, like all that knowledge is useless. And the one way to do that is like build a strong relationship, build a strong connection with them first, because they're human too. Like, you want to
Yeah.
see them as a human, not another case or not another patient. Um,
Hmm.
and so for me, like the ones I've connected with really well, or the ones I respected a lot, were the ones that, were very personable, had wanted to develop a genuine relationship. And honestly, that's my why. That's my, you probably heard this a lot. Like, what's your why in PT? What's, um, what's your purpose in PT? And for me, it's like it's all about the relationships. That's part of the reason why like I still keep up with like, Zaire and like, with Julian Rushwain now, and then, a couple of other people. For me, it's like I value those relationships and I just want to continue that because I see
Right.
them more than, just high school teammate. I see
Right.
them as like, good friends as well.
Right.
Yeah. What
Yeah.
about you though? What's your why?
My why?
Mm,
Hmm. I don't know if I know. Uh,
just fun.
I don't think I know. But I
Yeah.
just like to I really like people.
That's-
I really like people and I like helping people get closer towards their goals.
mhm.
Um, and then also just moving, like movement it's just like it's almost like a spiritual practice for me. Like
Yeah.
I don't know, I just love to move. Like and I have to move. Like my day is always revolved around like even now when I have less stuff, like my day is completely revolved around my workouts, movement. I don't know, it just feels good. I want to be able to take care of my family, like
Yeah.
in all my friends that I love, and I want to be someone they can lean on for health advice.
Yep.
Because if you don't have your health, then what do you really have? Like you could have all the money in the world, it doesn't matter.
Yeah.
If you're in pain or if you're not able to spend time with your family or move. So I don't know. I don't know if that was a very specific answer, but I
No.
think somewhere in there lies my why.
Yeah. I mean, no, that's a great why. I mean, the only reason I asked is a lot of times you go into a profession and we're just like just doing it just cause. But for me, it's like I want to make this profession worthwhile. And so, why not make it more meaningful and find a purpose in, pursuing a career?
Right.
At the end of the day, we're lifelong learners. And even, myself, like my why, it's always changing. It's never, I have my solid, my foundation. And it's just like, just building on top of that. So it's, even when I'm studying, I'm just like, dude, why am I doing this? Just asking myself questions like that, or it's like, do I really want to do this? And then so, just going back to baseline, just like, remembering, why you're doing this. It's, it'll keep you sane in PT school. So,
Carry you through the tough
oh yeah,
times.
it will. It
Yes,
will.
sir. It'll all be worth it.
Oh yeah, for sure.
Well, Pac, I appreciate you taking the time, bro. I think you shared a lot of knowledge. And I think people going into this field or people who might be interested in going to this field can learn a lot from just listening to you and hearing your story. So I just want to say thank you. I really appreciate it.
No, I got you. Thank you for reaching out. I mean, it's been a minute and I'm excited for you, super excited for your journey. Like it's big time. Like, you don't realize you know, how big this is. I didn't realize it when I first got my acceptance, but it's truly a huge accomplishment. It's a doctoral level program and, all your sacrifices from, previous years and all your experiences just leading up to this point, like you're finally there. So, huge congrats and I'm super excited for you.
Appreciate you, Pac.
Yes,
Much
sir.
love. Yes,
Nah,
sir.
thank you,
And
man.
I'm excited for you too, bro. We got to keep this relationship going and
Oh yeah.
I don't know, keep building relationships because yeah, I think you're gonna do some awesome stuff.
Yes,
Excited,
sir.
sir. All right, I'm gonna pause it.